Sure, no problem.
Perfect.
And Jeff, remind me, this is it 2 hours and that includes the Q&A?
Yeah, I suppose we can go 2 hours.
I couldn't remember. No, I just couldn't remember. I remember what time it started, but I didn't look
Yeah,
to the end.
I suppose it depends on the discussion.
Yeah. Well, what did you schedule it for? Then I'll
2
look
hours.
at it. 2. Okay, good. Okay.
2 hours.
And then you can just let me know whenever you want to start, because I know there might be some people you're waiting for.
Okay.
Hey, Annette.
Hey, Shirley.
Oh, hi, Pam.
Listen, those masks are such a hit. I just
Are
can't
they?
believe it. I said those masks are such a hit.
Oh,
I got
that's
oh my gosh, my parents actually wear them.
oh, nice.
Yeah, which is good. And they weren't wearing the other cloth, the other medical ones. So
Oh, yeah.
that was good.
Good.
Did you ever get my check?
I did.
Oh, good.
Thanks.
Okay.
Yep.
Yeah, we may need to see if your friend will let us reorder any, because I know everybody's out of elastic.
Yeah, I think so. He was waiting on his elastic, but I think he got him by now.
Yeah. I'll follow up with you later, but I might need to put in another order. I can do it directly with him too, to not bug you.
Oh, yeah.
Okay, sorry, I'm just sending some reminders real quick via text, so hopefully we can have a couple more join.
All right.
I'll be right back.
Yeah, I'm going to go get another seltzer water. I'll
Okay.
be right back. Okay.
Eric, if you want to invite people directly, you can tell them they can just join the Zoom link that I dropped in the chat.
Perfect. Thank you, sir.
They may not, they may be unfamiliar with the registration.
Excellent. Yep, I will send that out now.
Jeff.
Hi, Shirley.
Hi, Jeff. Turn your thing on so I can ask you a question.
Oh, yeah, go ahead.
I know that the grantees or whoever said they didn't necessarily need a prayer, but I'd like to offer one if that's okay.
Sure, that would be great.
We can wait for Annette to come back.
Okay.
Because I just think it's important because of the time we're in.
Yeah. No,
and our subject matter.
That would be more than welcome. I think it looks like we're still missing representatives from the Kanik tribe and the Eglutna tribe. And I think Eric said the Seldovia village tribe would not be able to attend.
Right, yeah. Kanik, I just sent a text reminder to. Eklutna was interested, so I sent them a reminder as well. It looks like Cassandra from Tyonik is on, and Michael Bernard from Salamadov tribe is on.
Oh, okay, great. Welcome. Shirley, I think we can get started whenever Annette comes back.
Okay, yeah, I'll wait for her to come back onto the thing. So my little thing says bottoms up. My cup, my glass.
Mine just says polar, polar seltzer.
And it's water. I know mine's water too. It's wonderful.
Mhm.
So I don't know about y'all, but I've been on nonstop Zoom for a while.
Yeah.
Oh,
Most,
okay. She's back. Yay. Okay, and I got here's my little holder. It's kind of made of birch bark, and it holds my my traditional, I call it my traditional tobacco, kinnick, and that's what I use, and then because it's not commercial, it doesn't have all the chemicals in it, and it's made all natural. So anyway, okay. Gishimani do mashkasi koyajini kazo migazito dem. Kagmiwi zago beginning and doing chapa. Jawini missionan gishimani do. We do koishin on Ishnabe gishimani do. I ask for help in a kind and humble way, gishimani do, for all of our people that we're helping with this epidemic, the other epidemic that we're into, not only the substance abuse and the opioid epidemic, but the epidemic that the virus that is affecting all of us. And I ask for help in a kind and humble way for all of our people, our Anishinaabe, our Native people, and our non-Native people, that we work together in a good way, and that we come together collectively, and that we pray together in our own way, because this is how we're going to help each other get through this and get through all the barriers that we have. I ask for help and pray for all of the people on this call and their relatives.
thank you, Shirley. All right. So I think most of us know each other already and have had several Zoom calls, but for those of us who are new here, I think it would be great to start with introductions. My name is Jeff Ladolter. I'm with the National American Indian and Alaska Native ATTC, and I've been focused on providing technical assistance to recipients of the Tribal Opioid Response Grant for about a year and a half now. Matt, would you mind introducing yourself?
For sure. Good morning, everybody. My name is Matt Ignacio, and I'm honored to be on today's call. And I'm bringing good energy and good thoughts as we enter in, this season and moving forward. And having positive energy is essential for that. So I'm bringing that to the table today. So hi, everyone.
Shirley, would you mind going next?
Oh, sure. Oh, hello, good afternoon. My name is Shirley Kane. My Ojibwe name, my native name is Sweetgrass Woman. And I'm with JBS International. I've been with JBS going on 3 months now. I'm just like so excited to be a part of this project. I come from a tribe in northern Minnesota called the Red Lake Nation. And I'm also an attorney and a former tribal judge, and represented numerous clients across the state, and just have always enjoyed doing the work of helping people. And I'm just so excited about this work, even though it's tough work. I think it's so needed, and I'm grateful. Thank you.
Thanks. Pam?
Hi, everybody. Pam Baston. I've been in the field 40 years and I worked at all levels of care. And I now work with JBS International for about the last 27 years. And I think I'm doing this primarily, I work on the TOR initiative, but also I've brought in about $100 million in grants doing it part-time. So I have a pretty good track record with writing grants, and that's what I'll be focusing on as we work through today's assignments.
Thanks. Joanne?
Thank you, Jeff. I'm Joanne Reser. I'm from South Carolina. My background is public health. I've worked for our local healthcare system, serving, working working to support folks in rural South Carolina, addressing social determinants, all the barriers associated with that. I've also done grant management, particularly in the area of women's health, and looking forward to hearing your challenges as you move forward with designing your programs. Thank you.
Great. And Michaela, I know you have kind of a fraught internet connection. Would you mind introducing yourself too?
Hello, everyone. Yes, my name is Bikela Ikoba. I am one of the graduate students at the University of Iowa. Specifically, I'm in the Master of Public Health program in Community and Behavioral Health. Yeah, I'll be clacking out some notes here, so I'll mute myself so you don't hear my keyboard. But yeah, it's just a joy to be here and in this space, and I'm grateful. So thanks for having me.
Great. Eric?
Hey, good morning, everyone. Eric Watson, Cook Inlet Tribal Council. I am our village liaison, and my role is to support and work with all of the federally recognized tribes in the Cook Inlet region. We have 8 tribes. Right now, I believe there's 3 represented on the call, and hopefully others join this morning. My role is to assist with communication, partnership building, and capacity development. Capacity building and partnership development. And so I just support the tribes as needed and kind of in the liaison between the tribes and CITC.
Thank you. Annette?
Good morning. My name is Annette. I am the TOR project director for the Ninilchik Traditional Council. And then I also help manage our medication assisted treatment program. And with that, I manage, patients. I do education. I do drug user health education. I volunteer at our local syringe exchange as well, and creating like networks with our active users and those who are in recovery. And then I also act kind of as our case manager. So when they come in from medical, I can do an integrated assessment if they want to go over to behavioral health, which is funded by the MAP PDOA grant. And so we have that grant as well.
Okay, thank you. And then it looks like we have the 2 newcomers. Cassandra, I think we've actually met before, but would you mind giving a brief introduction?
Good morning, everyone. I'm Cassandra Croto. I work here in Tyonek as a project director for our TOR grant. I also oversee our Native Connections grant, and I'm also a health director for our Indian Creek Health Department. So I'm from Tyonek, and that's about it. That's all I have to say. Thank you. Good morning.
Thank you for joining us today. And Michael Bernard.
Hey, good morning, everybody, and thank you for having me on this call today. I live in Kenai, and I'm a member of the Salamanov tribe. My background is in prevention and intervention with youth, but I recently started working for the Salamanov tribe, and I'm on the ground level of trying to put together a youth program. So I've written a few grants, and I'm waiting to hear back on those, and I'm also looking for others. So if you guys have any leads on those, I'd be happy to hear about those. In the meantime, I've also been asked by the tribe to write a few other grants, and the TOR application is one I'm working on right now. I'm very new to treatment and all that kind of area of expertise. Is not mine right now. Like I say, I'm with youth, but happy to be here and looking forward to just absorbing anything I can. I'd really like to acknowledge Eric and Annette. So far, they've been just very helpful for me and a wealth of knowledge and information. So thank you guys, and thanks for having me today.
Yeah, thank you for joining. And just a quick question, Michael. I know you haven't had a TOR grant before. Can you tell us about where you are in the application process?
Sure. I've kind of been stumbling through. Eric's been helping me a lot, and we've kind of started on the narrative. We think we may have come up with a budget, possibly. So the process is pretty new to me. I come from working with a tribe that had grant departments and people that would contact me and say, hey, do you want to go after this? I just say yes and send them some information. So that's me now. I am that person but I don't have anybody to go to and say, hey, what do you want to do with this project? And, how much do you want to spend for this and that? So, kind of put in the cart before the horse type of thing, but probably should have had a meeting like this before we started working through it, but we're at the ground level, very, very low level right now. And I think we're getting through it. Eric, what do you think? I mean, we're getting there.
Yeah, I think so. I think, the neat thing about this is that you are truly building capacity and you're starting from the ground level. So the sky's the limit. You have a lot of wonderful plans that you and your leadership have discussed, and just trying to be strategic in writing this TOR grant to have those plans in mind moving forward, to where you're not just addressing the requirements of the TOR, but also that future vision of a treatment center and behavioral health services and that sort of thing. So,
and since this is so new, I really think Annette, we've been kind of taking some of her outlines and trying to work through it and make stuff ours. But the sky's the limit right now. I'm really open to any suggestions, and I've got a few questions I've written down. So hopefully when that point comes, welcome any suggestions and answers that you might have.
Okay, great. Pam, where would you like us to get started?
If you can open the TOR application and scroll to the very first page, it'll be the second page actually, but the one where you see the yellow highlight. Perfect. Okay. Okay, so we have a lot to cover and not a lot of time. And what I'll try to do is, try to get through a little section, then I'll stop and take questions, and then we can just keep plowing through if that works for everybody. The couple of things that I wanted to point out, and two things that happened during your introductions that were really interesting. One is that you mentioned one of you had a Native Connections grant and another MAPADOA. And remember that later, because there's a section where it asks you to make sure that you are coordinating whatever you're going to be doing with this initiative with other opioid federal initiatives. And that is including those that are funded by SAMHSA, who's the funder of TOR, and also even other initiatives you might have, so that we don't want any federal money duplicating. You don't want to duplicate efforts if there's other initiatives going on. So there'll be a time and place to put that in, but it was excellent that you all mentioned that in your introduction, because you're gonna want to talk about that in a couple key spots, which I'll point out here in just a minute. Wanted to tell you very briefly that this initiative, this is the third round. And there have been some evolutions that have happened. And the primary evolution that has happened is that there is an increased emphasis on medication-assisted treatment, even to the point that there's brand new language in this application that says that you are not permitted to deny someone a chance to be on medication for their opioid use disorder if they are diagnosed with an opioid use disorder. They might choose not to pursue that pathway, which is okay, but you can't refuse them. And that has been put in there because there have been some challenges with some stigmas against medication-assisted treatment, and that's okay, but they've made it pretty clear that these funds are really to try to get that life-saving medication in the hands of people that have opioid use disorders, whether you do that directly through your own services or whether you do it indirectly through a community referral. So what I do is I highlight in here some of the key language that you might want to include. For example, when this in this executive summary on the screen, it says that the program aims to address the opioid crisis in tribal communities by, and here are some of the key words you'll want to use in your goals and objectives and in other areas, is it's about increasing access. So that's almost one whole process to culturally appropriate, which is really key to make sure that these are appropriate to your respective tribal culture, and evidence-based treatment, including MAT, using one of the 3 federally approved medications for the treatment of opioid use disorder. So really this idea of increasing access is very important. And one of the lessons we've learned through TOR, the past cohorts that we have, is that be very careful about the if we build it, they will come. Just throwing up services doesn't increase access. You really want to step back and think, what are the little building blocks that you might need to put in place to make sure that access is truly increased? So that means there'll need to be, and we'll talk about this in more detail in a few minutes, but you know, that means what kind of outreach will you or someone else in your community do? Who will be the voice of that outreach or the face of that outreach? How will you get the word out that there's some exciting new services coming? You know, that yes, one of them does involve a Western medication, but it's a medication that not only has been used successfully in countless tribal communities across the country, but can be integrated with tribal cultural traditional practices in ways that make it even more effective. So thinking about increasing access is very important. Thinking about how to integrate with your cultural practices and making sure that that it's evidence-based. And Jeff, are you controlling, or am I yeah, thank you. And of course it's due on May 4th. Just pay close attention that the time that you uploaded in the system, that you account for Eastern time when it's due. You know, that you don't miss it by, you know, a wrong time adjustment there. So go ahead.
Excuse me. Jeff, could you go back up to that first page on the right there with the money? So how much are they eligible to apply for?
So we're going to talk about that in a few minutes. I'm trying to go sequentially. Yeah, but Shirley, what it does is, and there is a question about this, you are given the amount of money you can apply for based on, well, you can go ahead, Jeff, in advance all the way to attachment K. It's one of the last pages and probably is the very last page of this. I'm trying to avoid people getting, there it is. I get like motion sick.
Yeah, I don't see a form, sorry. I don't see I mean, I have a copy of the FOA, but I don't see what you guys are looking at.
Oh, okay, Jeff, so maybe, are you able to share the screen of the?
I just sent copies of the handouts. Let me know if that's not.
Oh, you sent it to my email?
I just sent it.
Well, it should be able, and Jeff, we're not hearing you also if your voice is muted. So yeah.
You should be able to share. I've made you a co-host if that's easier for you to.
But no one on the call is seeing it for some, or is anyone seeing it or no?
Not right now. There it is.
I just don't see that. I mean, I have the FOA, but I'm not seeing the highlighted stuff that you're looking at.
Okay, are you seeing this page up on the screen now with one yellow highlight?
Nope.
Nope, okay.
Huh.
So
I'll just go through it. I guess I'll pull, I have my FOA because I have 2 screens.
Okay.
So I'll pull the FOA up on my other screen and look at it. And that's
So if you see, and this is a question that I had for Jeff, and I don't know if anyone else on the call understands this. So you can see this chart that says how much money you're eligible to apply for. Past grants would have the name of the tribe in the exact amount. This is different. This says 1 to 5,000 user population. Does that mean something to anyone on this call? A user population? Because I don't know if that means the size of the tribe or the number of, when I hear user, I think substance user. I don't believe that's what it means. It might be users of health services or the number that you've identified in your tribe that use behavioral health services. I'm not sure. But does anyone on this call know that? Because we'll get that clarification for you if someone else doesn't know the answer.
I don't know for sure. I suspect it's the target population.
The numbers of individuals that use behavioral health services or the size of the tribe?
I assume it's the size of the tribe.
And I do too. That would make the most sense, but we'll get that answer to you. But
Pam?
why this is key is you can, the least amount of money you'll get is 125,000, which is good because in the past it was 50,000, and that's not even enough to hire a warm body, one person. You know what I mean? So we'll get back with you on that. But if you can go back, Joe, did you say I control it now?
Pam, can I just interject
Yes.
something quickly?
Yes.
I think, because I've reviewed a lot of the applications that have come through from the previous grants. And what a lot of them do is they put the total population and they put the population that use their systems. So they do both.
Yeah. And I don't know what this chart will be for. So we'll have to clarify. Yeah. Hopefully it's the size of the tribe, because the issue is that a lot of tribal communities don't have that data precise to know what their user population would be. And because of stigma, you could undercount the numbers that if you really do a good stigma reduction campaign, which I'm going to talk about in a minute, and we highly recommend should be one of your activities, unless you've already done this work with other grants, and then it wouldn't be, then I would at least mention, we've already done a tremendous job in our community, reducing stigma through various awareness campaigns. But at any rate, that's why I'm hoping this is the size of the tribe and not just users, because that would put you at a lower level of funding if it was. So back to the beginning, did somebody have a question?
Yeah, I mean, just to touch on that, I don't know about other people, probably because there's people on this call from Kanik, which is another area. And so like our service area, our tribal boundaries are very wide or very broad. And so I would be curious to know if it's population of people who live in your community. Is it people who are in your tribe? Because is it going to be, my target for my grant is 10 people. I'm keeping it very small, but there's let's say there's 80,000 people that live in my area that could be potential people. So, I mean, I would be, and we only have 2,500 members enrolled in our tribe.
Right.
So I have 3 different numbers to bounce off of.
So I'll come back to your number. I would encourage you to serve more than 10, depending on what size budget, because you're allowed to ask for less. You just can't ask for more. But what's going to happen at some point, you might want to divide the number of people that you are intending to serve with the total number of dollars and make sure that that math is defensible. That you're not at, we're going to spend $30,000 for each client or something like that. Do you know what I mean? But we'll come back to that.
Because I can only fund 10 people.
That's all you get the money for. Okay.
That's all I can do with the money that if it's going to be based on how many people you're going to serve.
Right.
Because we're going after people who are still actively using.
Right.
For our TOR grant. So.
And you will have some people that drop out and so forth. So you may. So, but let's go back, because I don't want to get out of sequence here. If we can go back to the beginning, because there's a logical order that will follow. But we will, and Jeff, we're not able to really communicate directly with SAMHSA. You can, but if you can, it'd be great if you could even shoot that question while we're on this meeting to and see, it would normally, who would answer that quickly, but I don't think he's even there anymore, is Ramon Bonzon,
Right.
or Amy Romero. somebody, they would probably know, because Umberto will have to then go over and ask that other division. But we'll get an answer to you on that. But let's, if we can go, am I controlling this now? Did
Yeah, can you try to scroll up?
Yeah, let me try to scroll. And what we'll do is we'll start back at the beginning, because I'm kind of a little bit off track. I don't know how to see. No, mine's not moving. Mine won't, it won't let me move it. So
Oh, there you go. Give it a try now.
Okay. Yeah, I don't even have anything to hold on to. Well, let's see. Yeah. Oh, there it's going. It's just slow. Okay. Sorry, guys, that I had to go all the way back, because it's a lot of pages. Or is there a fast way I can do this? Because I get motion sick.
Page up or drag the cursor at the right.
That little thing on the right there. There you go. Pull it up.
Okay, we're way. Okay. Yeah, mine's not grabbing very well. Let's see, getting there. Okay. So, let's get past the, wow, and this one looks like I don't have any yellow. Oh, there we go. Okay. So we got May 4th as the deadline. Now, you notice that they're going to fund 200 grants. For the most part, these are non-competitive according to the language that's in here, which means that more than likely you will get this if you turn in a, responsive, it doesn't have to be perfect. So, don't throw away the good for the perfect, because, there's not as much time as I know you might want to put this together. And why is it not moving? Oh, there we go. Okay. So, let's start. First, what we're going to do is we're going to, and this, you know what, Jeff, I'm so sorry, but it is not my, it says I'm controlling your screen, but it's all like delayed. Can you take me back and you do it, and we'll just start from the beginning and not. And
yeah.
Okay.
No problem.
Sorry, everybody. All right. So if we go back to, there we go. Program description. Thank you. So in addition, you want to obviously read the whole thing and read it more than once, but in addition to focusing on opioid use, you are able to address stimulant misuse and use disorders, which tells me that's other substances, not just stimulants, but primarily they're looking at opioids and stimulants, and the stimulants being, cocaine and methamphetamine. Now, keep in mind, and this would be important to remember, that while you may be dealing with people who are using methamphetamine, increasingly that meth has opioids in it, mostly fentanyl, and they don't know it. So, like, we lost a little girl recently who overdosed. Everybody said she was on meth, and nobody used Narcan overdose reversal on her, when yes, she was using meth, but it had fentanyl in it. And if they had used the overdose reversal, she would have lived, or might have lived. And she was 21 and gone. And so what we just have to remember is that meth these days rarely is just meth. So that's important for a number of reasons. But when we get to the section of discussing your statement of need, if you believe that the population you're serving is polysubstance users, which most of them are, even though this grant primarily focuses on opioids and the bulk of your narrative should focus on opioids, feel free to discuss meth and other stimulants, and just mention that you are aware, and we'll make sure your clients are aware that the stimulants that they are using may often, unbeknownst to them, include fentanyl or other opioids. So look at these other key words here, if you can see this, that the intent is to reduce unmet treatment need. These are all key words. And opioid overdose related deaths. So if you want to take a step back and think, what is the intent of this funding? It's increase access, reduce unmet treatment need, and reduce opioid overdose deaths. Those are almost like three goals right there, three big overarching goals, under which lots of detail can be, embedded. And they tell you in this how they want you to accomplish this is through the provision of prevention, treatment, and recovery support. So you're really given kind of three categories or three methods of how you will attain those goals. Now, how you prorate what you're doing how much prevention, how much treatment, how much recovery support, how many dollars you allocate to those. It doesn't specify. So that gives you some freedom there. And also, it may be that if you have a low amount of funding, that you can't do all of these at the same time. So maybe you start with one and start building them in over the course of your 2-year period. Also, it may be that if you have some really good opioid prevention already happening in your community, then you will mention that in the very first section that we'll get to in a few minutes, so that the reviewer understands, well, the only reason I didn't put a lot of time and effort on prevention is we have a robust prevention system here. So we're focusing more on treatment and recovery. So don't be hesitant to talk to the grant reviewer, the person who's reviewing. They don't know what you already have and don't have. So feel free to explain in your narrative, the rationale of how you ended up structuring this prevention, treatment, and recovery. So then it says tribes will use the results of a current needs assessment. And so if you have a needs assessment, you'll want to use it. If not, you'll carry out some kind of planning process that you'll be looking at what the needs and capacities are locally. It's a little bit difficult here because while it says you have to do this, later on, it offers this as an optional activity. So it's a little bit of inconsistency in the wording. And we'll come back later to how you might do this when we get to the section A. And also, here's some more language for possible goals: to identify gaps in resources from which to build prevention, treatment, and community-based support. Recovery support. So, you're expanding access, you're reducing unmet treatment needs, you're reducing opioid overdose, and you are identifying gaps in resources. Those are all really critical activities that you will want to discuss in the grant using that kind of terminology. And then how you will expand your access and advance your services in coordination with other federally supported efforts. So again, connecting the dots of other resources that you have. Now, one of the documents that they ask you to take a look at, and Jeff, see if you can maybe pull this one up. There is a tribal behavioral health agenda that you've probably seen. And we won't go through it. And I attached the wrong thing, sorry. There is an actual tribal behavioral, although this document might help you. Can you go through it a couple? There was a couple really good goals in there in the tribal behavioral health agenda that you can look for language. Does it even show like the link or the picture? Okay, so there is, if you even just Google those terms, tribal behavioral health agenda, you will see a very cool, yeah, that wasn't it, sorry. You will see a very cool plan, and in it, it has goals and objectives for prevention, goals and objectives for the workforce, goals and objectives for treatment, for recovery support. So and before we end, we'll make sure we get you the actual document up, and that was my error. Then you will see, you can get some idea of some really good language framing that also, and a lot of thought went into that tribal behavioral health agenda. It's very well done. And so that could even help you kind of frame out your thinking about how to structure your initiative. And if we can go back to the RFP, then in a few minutes, we'll start getting through the actual section A, B, and C. So we'll just scroll down a little more. And there's the link right there. That's the link that, and I wonder if you can click on it, Jeff, and if it will take us there live or not, because this is, and the artwork on it is stunning. It was beautifully done. I don't know if it's going to open or not. Oh, it looks like it did.
Pam, you know who is on the signatory?
Yeah, is Garcia, right? Chairman Garcia.
Jose.
Yeah.
Or Joe. Yeah.
Yeah. He's incredible. Okay, so this is the document. The link is right there in your RFA. But if you will go, Jeff, just scroll to the, like it has a little, what do you call it? Like a, there. So here, and maybe just keep scrolling a little bit, you'll see a grid in a minute that shows you all the different goals and objectives that relate. And this is all great background narrative, by the way, if you need, if you need to pull in, you know, some of these populations like veterans or youth or what have you. Keep going. And I know it's tempting to talk about all these other things like suicide. And there you go. Go back one more. See these right here? These are all very well written. These are like strategies that help you deal with historical and other trauma. Chart 1. There's multiple charts like this. And Jeff, you can keep scrolling through that. You can see here how crisp the language is of all these priorities that will, that one's around culture. Keep going. You'll probably see some here in a minute on prevention. Which one is that? That's on recovery. That prevention and recovery, some really good narrative there. Some good behavioral health goals and strategies there. And then some more awareness and visibility. And I think there's even some workforce ones back in there somewhere. But anyway, I think, thank you, Jeff. We can go back to the RFA or the NOFA, but you can see how valuable that document can be. Not only are you being asked in the grant to review it and include it, but you want to tell the grant reviewer you did that. And one of the things I think people miss the opportunity is to realize that you really need to talk to whoever's reviewing your grant. They don't know what you've done or haven't done. So you can say somewhere in there, to prepare for this application, we reviewed the tribal health agenda, and many of the goals and objectives or strategies that we are recommending are in alignment with that agenda. So in other words, by you accomplishing your goals and objectives, you're helping this national strategy move forward. So that's a very powerful thing to mention in your grant. So then what you're supposed to do here is to have some kind of strategic plan or some kind of needs assessment, and then you are going to be identifying what goals and objectives and strategies you want to implement to align with those goals. So hopefully, and we can keep going down a little bit, hopefully you will have some kind of data. There's also your tribal epidemiology centers that you can contact. Okay, that's a good spot to stop. That will have some data that you can use to coordinate with your TEC, your Tribal Epidemiology Center. And if you don't know who that is, you can Google that. And they have data that they should be able to share with you. So here's something that has been missed by several grantees. You are required to have a full-time project director at 1 FTE. Now, let's talk about that, going back to the example that Annette, you offered of 10 clients. So if you're required to have a full-time director, and let's say for now, just for talking purposes, you charge that person to the grant, and you're going to serve 10 clients, and that is a clinician, let's just say, or more than one if you have some, you know, then you're now having 2 or more positions that are serving what would be potentially considered somewhat of a small population size. And so your cost per client could become very high there. Now, I realize there's a lot of geographical issues and size, community size issues, but you may want to consider getting those numbers up by saying, maybe we're only going to provide treatment to 10, but we'll do some prevention messaging. We'll do maybe some prevention campaign or something. Now, again, I don't want to tell you how to write your grant, and if that worked for you last time and you want to go with that, I just want to offer that as a grant reviewer. I've been a grant reviewer for many years. I am not one now. and I'm not one on this one at all, I would just want to really look at that budget and see, you know, is this cost falling within what we call reasonable cost bands? And I know you get bigger cost bands when you have difficult geography in Alaska. So this may not be an issue at all. But I also want to point out that it says here that even though you're required to have a full-time project director, you are not required to charge the entire salary to the grant. So in other words, you could have, if you do worry about the cost being too high, then if you have that you're sharing that position, you know, maybe some other funding source you have is helping to pay for that project director. I want to stop there before we go through the required activities, but also know that your project director position has to be approved before you start. So you'll be turning in a resume and a description of your project director, and you don't have to get it approved before May 4th. But once May 4th comes and they fund your project, they're going to ask you to send, they're going to want to approve that position. Want to stop there and see if we have any questions. Okay. All right, so let's go
Like
through.
in the chat that Cassandra asks if we can apply for the amount in user population if our current grant is less than shown.
Say that you faded out on me. What? Say it again.
It looks like Cassandra asked in the chat more about the user population. I was able to send a notice out to the grant manager.
Good.
We will have an answer for you soon.
Yeah, and the question is it can she apply for a second grant if she already has one?
I think she's asking if she could increase the amount to what is allowed.
If her current, so will her current grant expire before this one picks up? And is she muted? Maybe she can just be unmuted and ask, because really this is kind of a complicated, and we may not have the answer. She may need to send that to SAMHSA. But if you came in under an old TOR, let's say cohort 1, and your grant is expiring, then the answer would be yes, you can go for a greater amount of money, as long as it fits within what SAMHSA is calling that user population. So, and I think and she'll want to, because it's really hard to do anything with less than that lower level of money. They're offering 125 and higher this year. People that had 50,000, like I said, it was really hard for them to do much more than a campaign. So we can come back and answer that question, Jeff, but just for time, if you can just scroll a little bit more, I want to go through the required activities.
Thank you.
Thank you. If it were me and I were writing required, and I knew these were required, I would almost cut and paste these required activities into a chart. And then and so I would have them listed in one column, and in the next column over, I would describe exactly what my tribal version of that would be. So now, what the other interesting thing here is, it's asking you to select activities, which infers that you have some options here. So, you know, but it doesn't say how many. And again, you know, this is if you're getting a lot of money, maybe you would want to address all of these. If you're going for a smaller amount of money, maybe you go through and you pick out a few of these required activities that make the most sense for your tribal community. The strategic plan, by the way, doesn't have to be a high cost, expensive thing. We even offer a template that you can use and fill out that's very basic. But what you might really want to do is see what kind of data is already available, like I said, through your Tribal Epidemiology Center or through other planning processes. What we found in some of the past TOR grantees is that many tribes had a really good needs assessment or a really good strategic plan. However, those plans and needs assessments often did not mention substance abuse, nor did it mention opioid. And so keep in mind that, and I should have said this at the beginning, what makes this grant different than any other grant that's ever come out of SAMHSA is there's been lots of mental health grants out of SAMHSA, a ton of mental health grants, suicide prevention, circles of care, but very few grants to tribes to address substance abuse, and never any for opioid. So, you know, this is a real opportunity, not that you don't want to also mention mental health, because we know that co-occurs with substance use, but I would be very cautious about not spending too much time going down mental health pathways without really adequately addressing this substance use, and specifically opioids and or meth. So I want to cover a couple more of these and then we'll stop for questions.
Actually, Pam, if you don't mind, I got a response from the grant manager on user population.
Yay.
The definition of a user population is patients who receive direct or contract health services from IHS or tribally operated programs that are registered in the patient registration system. So those registered Native American patients that had at least one direct or contract inpatient stay, ambulatory medical visit, or dental visit during the last 3 years. And I'm going to paste that.
Okay.
Sorry, is that only for people who have opiate use disorder then?
No.
No.
So if I pulled our clinic record and it said that we have served 300,000 people in the last, we could go for that amount.
You could go for the amount that corresponds to that. If they got dental, or what was it, any health service or dental in the past 3 years, is that what you said, Jeff?
Yes, inpatient, ambulatory, dental.
So ambulatory,
almost everything.
Everything. Annette, does that answer your question?
And do they have to be, my understanding was that this last funding was for anybody in the community, because we serve non-IHS as well, because we're a community clinic. So can that be any number? What does that mean?
That's a good question.
You know, we're told that the TOR funding, it's open to your community. We have more non-natives in our community than we do natives.
Okay.
So
I think that the best move here would be for you to write that exact question, send it to Jeff, and Jeff can send it over and get exact clarification. Because the thing I worry about there is, Jeff, there was 1 or 2 words that you said that to me means something different, which was something about it registered. What, can you read it again slowly, the exact thing they sent you back, Jeff? Oh, wait, we can't hear you. Can't hear you, sorry.
That must happen 10 times a day.
Sorry.
Patients who receive direct or contract health services from IHS tribally operated programs are registered in the patient registration system. You know what, Annette, I'm going to reply and I'm going to put you on this thread.
okay, because that would be the difference between this current one and this upcoming one.
Yeah.
That impacts my whole project. And my whole project changes everything.
Total game changer. Yeah. So now let's see what they say. I feel like they're looking for something that you can document somewhere to show like the number of registrations in that 3-year period. But we'll see, because you're right, that could be a complete change. So we know that you want to have some kind of planning process, or mention it if you can, and you can again conduct that planning after you get the grant. You just need to mention that how you will go about that, and how you might accomplish it. Some grantees hired a strategic planner, a Native person from their community that had strategic planning experience, or some other expert to help them with their planning. Some just literally did nothing but take the plan they already had and add a couple new goals and objectives. The key thing here is that this issue is so important that SAMHSA wants to make sure that it is showing up on the radar of the tribe's planning process, so that when this money goes away, it will be embedded and will live on, and hopefully get attention and funding and support when this money is gone. So if it's not written down anywhere, it doesn't show up anywhere in any kind of planning, that puts this at risk. So that's why that's there. But this next one's really, really, really important. And it's workforce development activities. Now let's break that down. This could be something that's enormous, or it could be something that's very minimal, depending on the needs of your community and your funding. But one of the things that we see is there is a lot of education that the workforce needs. And by that, I mean not just your behavioral health workforce, but remember that almost none of these clients that you will serve through these funds have only opioid or meth use as their challenge. They usually have employment challenges, housing needs, childcare needs, transportation problems, health issues, mental health, all kinds of other needs, spiritual needs. And so that will require you to not work in a vacuum with this grant, but to make sure you're partnering with these other community, resources and other tribal resources. And to do that means that you not only have to educate your staff, but all the partnering agencies and resources that you might work with, to help that individual with an opioid use disorder in recovery. And what I mean by that is that not only to address stigma, but there's a lot of incorrect information out there about, if you use medication, you're just changing one drug for another. When this is no different than using a antidepressant or a anti-anxiety, so it's really discriminatory to say to someone, we don't care if you use a mood altering medication to address your depression or your anxiety, but you better not use it to heal from, to reduce your cravings for opioids, So there's a lot of work that needs to be done with the workforce to bring everybody on the same page about the science, and then about how do you integrate tribal practices, whether those are ceremonies or smudging, and we'll talk later about examples that you might propose, but how to integrate these all the whole person. Really, it's a whole person service. So doing some kind of workforce training is, so whether you go out and do 1 or 2 trainings, or whether you have a brown bag lunch, or whether you do, something with soup on Saturdays, or however you're going to do this to educate the workforce, your own and others, you'll want to mention that in the grant. Then deliver effective strategies, effective prevention strategies, which include but are not limited to elder education, outreach, engagement of youth, strategic messaging, and community prevention. You don't have to do all of these. You're also able to purchase and disseminate opioid overdose, naloxone, which you might know as Narcan. Just remember that if this is already being done and done well by first responders, by hospitals, by police, by fire people, if it's already being done, you don't want to duplicate that by taking precious grant dollars and doing something that someone else is already doing. But if they're not doing it sufficiently or well, or and there's a lot of stigma around bringing somebody back the second, the third, the fourth time, because we know that often they overdose frequently, then you might have to do your own overdose work here if you feel like it's not being done appropriately. But the thing to remember here is that you have the best opportunity you have to engage someone in care. It surrounds this overdose. If they overdose, what can you put around them in terms of a safety net? Because the first thing that'll happen typically is they're going to be pissed that they got brought back. That you ruined a good high, they spent good money to get that buzz, and it was sure good. It knocked them out. And why'd you have to bring them back? And they're going to want to go out and wash, rinse, repeat. You know, they're going to want to go out and do that again. So if you don't, and if they have that overdose out of their system, when that overdose reversal, they are at a really sensitive degree of what do you call when you have tolerance? Their tolerance is very fragile. So they can very easily overdose again and die. So you want to make sure, you know, do you have recovery support, peer support, people that will sit with them, people that will hold their hand, a place for them to be where they're not alone, you know, until they get connected to care. And so these are the kinds of things you might want to talk about if you do this particular activity. And I want to stop first and see here if we have any questions from any of the grantees about these first three required or potentially required activities.
I think we have some in the chat, actually.
Okay.
Yeah, so the state of Alaska has Project Hope. So the state of Alaska dispenses Narcan. And that's provided by the SOAR grant.
Yep.
And we don't know, I haven't heard anything back from Shylin. I think he's writing for it, but I don't know if he's gonna get it. So my question is, can we purchase fentanyl testing strips? Because those are overdose prevention. Can we purchase like that kind of gear?
So I love that idea. And I think now those are allowed. We'll look before we hang up to see if it's in writing as a prohibited, because remember it used to be like syringe exchange and all that kind of stuff was a no can do with SAMHSA. But now the thinking's been more open around these things, and fentanyl strips might fall in, the testing strips might fall into the whole needle exchange, you know,
I can buy them, and I can buy them standalone from Nasan.
Okay.
The fentanyl testing strips and Hep C tests, which is a gap for people who are not accessing clinical care.
Right. I would put them in. The worst that would happen is they might tell you, put something else in, we're taking it out. But definitely put a sentence or two of justification, because you just said a beautiful sentence right there that, as you exactly stated, it should be what's in your grant, and maybe even in the budget with an asterisk that says, you know, these folks are not accessing, these are life-saving things, both of them, the Hep C test. So I would call them these life-saving, you know, strategies. Jeff, any other questions on these first three?
Looks like Michael asked where we would find that information. I think he means the user population.
If someone else has the grant open, they can look for, is it called prohibited or prohibited costs? And I'll look for it before we end.
I'm looking for the patient registration system. How would I access that information?
No, it's in the NOFA. And I don't know, Joanne, if you're on and you have the NOFA open, or if you can, or Jeff, one of you, just look and see. I don't want to scroll here because we have problems with that. I do, but we'll find out before we hang up this call. But there's something that usually says, you know, you can't, in fact, if you scroll for the word residential, that's usually where it is. They'll tell you we cannot pay for more than we can't. No, if you scroll for the word construction, that's usually where it is. It'll tell you you can't spend so much money on construction and this and that, and it'll have the whole.
Michael, would you mind dropping your email in the chat? It looks like Beverly, who is the grant program officer for this, says that she can look up the user population for a specific tribe.
Love that. Okay.
Oh.
Excellent, excellent, excellent. All right. Now, you know, I like to go for the beg forgiveness rather than ask permission strategy. So if we don't see fentanyl strips prohibited, then I think you're safe to put them in, just knowing that at some point they could say do something else, you know, with those funds. Do you remember how much they are per, how much are going to charge you for those?
Yeah, I have the thing from NASAN, and because we have leftover money right now, I was getting ready to purchase them. They're $100 a box.
Uh-huh.
And hang on one second. I got it this morning. Buy it from the Buyers Club. And this is the organization that our syringe exchange uses to get our supplies as well. So
does it say
so
how many come in the box?
yeah, so 100. There's 100 in the box, and the box is $82.50.
Wow, so less than $1 a piece. Not literally for less than $1.
And they are so popular, and I don't know if they're saving lives, but they use them a lot.
Oh yeah, no, they're saving. Oh, I mean, I can't imagine that you're not saving lives with that. Worst case scenario is if they don't allow it, maybe another grant or another source of revenue would allow you. But I am not aware of those not being permitted, but we'll look here in just a minute. Okay, any other questions about the first 3 required activities before we go to the next ones? Just want to make sure we get through all of them.
So we can,
okay.
oh, sorry, we can pick our required activities.
Well, see, look at the wording. Additionally, recipients are expected to select activities from the list below.
That's mandatory, right?
So these are, you are required to do some of these activities, and the more you do, obviously, I think the better, but you also have to make sure it makes sense to how much budget you have. Mm-hmm. And so, you know, let's say if it were me, I would try to do something for everything. Even if the strategic plan was I'm adding a goal about opioid use and about my project to my tribe's existing plan or my organization's existing plan. That doesn't take a lot of time or energy. It memorializes it in a key document that will live beyond the grant, and will be something that you can, you know, focus on. That doesn't cost a lot of time or money. And in terms of the workforce training, even if you just did 1 or 2 trainings, technically you've met that goal. But how far you drill down on these and how wide you go with what you do. If for example, you came from an area that in your tribal community, you have no idea how much opioid use is going on, it's like, then you might want to spend more time on getting this baseline through some strategic planning. If you already had a pretty good handle on it, maybe it wasn't perfect, but you had a pretty good one, I would then just state in your grant, we already have a plan. It already addresses substance use, including opioid. And so we will, you know, review it and refine it as we go along, you know, and update it as we learn. But if you have no idea, I would then say you put more emphasis on that. If you already have a well-educated workforce, then I would say, due to a very sophisticated workforce that has years of experience working with opioid use disorders and medication, you know, we don't need much of this. We'll do a brown bag lunch once a year, you know. So do you understand what I'm saying? That you calibrate these activities that are required based on the needs of your tribal community and the amount of budget you have to work with. But the way I read it, it says it offers you a chance to select. So I don't know how anyone could say you had to do them all, but to be safe, I would at least touch on them in some, even if it's a small way. And remember, you have a 2-year grant. So maybe some of these you do in year 1 and some of these you do in year 2. That's another interesting way to think about how you get these activities done when you might have a limited budget. And Jeff, if you could scroll a little bit farther down to see the next 3, however many are on this page. Okay, so implement service delivery models that enable the full spectrum of treatment and recovery support that facilitate positive treatment outcomes and long-term recovery. So this is saying whatever you do in services should address the full spectrum of treatment and recovery. So you might not have enough money to do, or it might not be in your mission of your organization to provide residential and inpatient treatment and all of that. And in some cases, you might need some withdrawal management that we used to call detox. But you need to be able to, whatever piece of this continuum of services, that spectrum, I think they call it, that you are going to be providing with these dollars, you need to figure out how does that fit within the whole of the whole range of substance abuse services that someone might need. For example, let's say you only are going to provide outpatient. Well, you might get a client that needs a lot more than that. Okay, well, it's beyond your capacity, you know, or your level of care, but you should be able to offer some kind of warm handoff to whoever does have that capacity, even if that's in a neighboring community, or even if someone has to get on a plane and go to an island, or, you know, wherever it is in Alaska. If somebody needs something higher or lower than what you offer, you should be able to speak to that, just very briefly. Also it wants, it's supposed to be evidence-based. And so they give you different examples here, the hub and spoke model, and also models of OUD treatment that also recognize mental illness, physical illness, infectious diseases, and so forth. And it goes on. And by the way, if you do use my suggestion of putting all of these required activities, cutting and pasting them into a chart, you won't want to include all this text here. You'll want to abbreviate it and just call it evidence-based treatment / medication-assisted treatment, Matt. And then, you know, because otherwise you wouldn't have enough room in your grant. But they're giving you a lot of detail here you know, individual group therapy, motivational enhancement therapy, cognitive behavioral therapy. In other words, once you have a client in your outpatient treatment, what are you doing that we know is effective in addition to your, you know, cultural practices? You know, are you doing anything with incentives, like with motivational interviewing? Are you using cognitive behavioral therapy, or the places that you refer these clients to? But of course, the main thing they're looking for is medication-assisted treatment. And, you know, there's obviously the three different medications, naltrexone, methadone, and buprenorphine. And you don't have to do all three, but you do want to know that for some clients, you know, ideally, the medication that is best for that client would be a decision made between the client and the doctor. But not all tribal communities have access to all three medications. So Annette, for example, where you are, what medications do you have available, directly or indirectly?
We use buprenorphine in multiple forms, and then Vivitrol.
Okay. So that's good. The only thing that sometimes is a hiccup is if a tribe, and this is not a deal breaker, but if a tribe only has Vivitrol, often, you know, what we're seeing nationally is there's not a real good long-term track record. People tend to leave after a few months on Vivitrol. And I don't know, is that they don't like the discomfort of the shot. I don't know if it's, you know, I don't know what it is. Have you had good experience with Vivitrol?
Are you asking me?
Annette? Yeah, sorry, yeah.
Yeah, so they don't, so when we talk with patients, you know, the reason that there's not a good track record with Vivitrol is because it just leaves the body, and they don't know when to come back for an injection, for the next appointment, any of that kind of stuff. And so, and the other thing is, you know, it's my job to call patients to say, hey, you're due.
Yeah.
And even then, they'll still, because we have some patients who are on the buprenorphine injection Sublocade.
Yeah.
They'll still come in 2 or 3 weeks later when they're like, okay, now I'm not feeling well. So it's based upon, you know, think about addiction brain, right? Mm-hmm. It's always based upon how do I feel? And if I'm not feeling good, and the other thing is Vivitrol, because it leaves and they don't know that it's gone, the overdose risk is so much higher.
Yep. Well, I'm glad to hear you say that, because that does meet with the experience I see nationally. That's why when a tribe says this is the only one we're willing to do, it's better than nothing, but it can be almost a death sentence if for the individuals that don't have a good support system that will get them in to get that dosing regularly. Like you said, they don't keep up with the calendar, and they don't even realize it's time to go back until they're already sick, or they don't feel well, or they go out and use because they don't have any protection anymore. So those are all very dangerous.
Yeah, and to note, they've our medical provider has a special waiver to be able to do inductions via telemed, because we do provide services in other communities, and it's a special waiver on top of the data waiver.
Wow.
So
I would mention that.
But now, yeah, and now because of all the COVID stuff, we can do it doesn't matter for any data waiver provider right now.
That's excellent. Excellent. Okay. All right. Then the implement community recovery support services such as peer supports, recovery coaches, spiritual support, social engagements, recovery housing. These are just any kind of community recovery support, peer supports, coaches. It's really hard for these clients to do it alone. And if you can get somebody who's walked that path before, and before we end today, we're going to alert you to a resource that we'll have posted hopefully in the next day or two that gives you like 15 or 16 examples of really innovative models, and Shirley can also be available to help you connect with which one makes sense, or Joanne. But from the Sober Squad to Not on My Res to Soup and Stories to, there's all these different innovations that grantees have already implemented that provide really unique, culturally relevant, sometimes culturally specific recovery support programs that will help these clients stay engaged in treatment so that they can, participate with the medication or other services. Just a minute. Okay, so provide treatment, transition, and coverage for patients reentering communities from criminal justice settings or other rehabilitative settings. So if they're coming out of jail or they're coming out of other institutional settings or programs or mental health institutions, and you need to help them, hopefully they will have been medicated if they had an opioid use disorder before they leave these jails and institutions, and then you just are continuing that for them. And then they want you to assess the impact of the grant. You're allowed to spend up to 25% of your dollars on sort of, this performance appraisal, performance monitoring, evaluation. And they ask you to consider working with your tribal epidemiology center or an evaluator to be able to get a good impact of the grant. And that should be ongoing. You should be figuring out how this grant is working so that you can make adjustments midstream if you need to. So I'm going to stop there. These are all the required activities. Then there's some allowable ones, which we'll go through more quickly because I really want to get to the actual format you have to write to for our remaining time. But I want to stop and see if anyone has any questions thus far. Okay. Jeff, can you scroll down to allowable activities? And if you're talking, we can't hear you. Okay. Those are the allowable: incorporating culturally appropriate traditional practices or providing prevention, treatment, and recovery for stimulant use, even maybe separate from opioid misuse. And you're allowed to use contingency management strategies, $15 or less in value, like incentives to get clients if they meet so many objectives or they, do what they're supposed to do with their treatment plan, that you can offer them $15 or less in value, but they can't get more than $75 in a year. So you could do like $5, $15, little incentives for them if they're, doing what they're supposed to be doing in your program. So I want to pass by this just quickly to get, so we can get to the actual format. But just know that you're not supposed to be using funding. You're not supposed to duplicate, in that if these individuals have insurance or Medicaid or whatever, you're supposed to get that to pay for the services to the extent possible, and not always hit up the grant when there's other ways that they could get paid through the VA or through Medicaid or what have you. Okay, if you could go to the writing sections now, Jeff, which is probably about 5 pages or so. And this is just reminding you, 25% you can spend of the grant up to data collection and performance assessment. You do have to do GIPRA, which is, and we're not going to get into that today, but there is a requirement that on intake and then 6 months after intake and at discharge, you have to collect data. And there's lots of help of how to do that. It's not easy, but you can get a lot of help on that through SAMHSA. But that is something that you have to mention that in your evaluation section, which we'll get to. So these are all the forms and everything that you have to have, and that's fairly straightforward. By the way, if you have not registered, there's like 4 different things you have to register for to get this. You'll want to start that process the minute we hang up this call, but we'll get to that in a minute. Keep going, Jeff. Keep going. There's some attachments here, but we're going to really spend time. Let's stop there real quick. Sorry, go back up for the attachment 1, 2, 3. Attachment 1 is any data collection instruments you're going to use. What most people do there is they say for attachment 1, we will use the GIPRA, GPRA, the GIPRA data that was referenced back earlier, and that way you don't have to include an attachment. You just show the link that links you to the GIPRA data forms. Then 2 is if you go to Appendix C of this grant, which we're not going to do just now, there's an assurance form you have to fill out, and that becomes your attachment 2. The consent forms, if you have a client consent form, even if it's one that you're going to adapt later for this grant, you can include it and say, this will be adapted if we get funded, for this grant. And then the last one, which is attachment 4, you'll go to Appendix D, and you have to fill out, and it's kind of squirrely, you have to fill out a very involved form called a confidentiality participant protection form. Do not let it scare you off. It is very complicated. You do not get points for it. So when you see it, don't have your eyes glaze over and say, I'm not even going to apply because this is so complicated. I don't know how to do it. Try to answer it. And we can, if you struggle with it later, maybe we can do another one of these calls, Matt and Jeff, to just give some pointers on how to do it. Just put a sentence, 1 sentence for each thing if you don't know how to do it, and say that you would like some help completing it after a grant award. It's not unusual to have difficulties with that form. If you have an evaluator, ask them to do it because they'll understand it better. Okay, let's start on the section A, B, C. Okay. Where if you just go to section A, it will say needs assessment. Okay, and it'll say, keep going. It was much further down in the document, like about 5 or 6 pages probably. Let's see. I think we were almost there where we were a minute ago. Okay. Yeah, a little tiny bit more. So it's 10 pages, single spaced, size 12 font. You can go to size 10 if you use a chart. But let's start. The good news is these are very straightforward questions that you have to answer here. So we'll spend the last part of this going over this. So section A, if you go scroll a little bit more so we can see the bottom sentence, describe the extent of the problem in your catchment area, including service gaps, and document the need. And literally, I would paste this exact sentence as it is on a page and answer every bit of it. So what is the extent of the problem in your catchment area? That could be your tribal community, however you define it. You would stop there and literally start talking about, I would almost reframe these sentences. I would say, the extent of the problem in our area includes, opioid use is common. It's common among youth or adults or women or pregnant women or whatever you're seeing, you're going to describe it. They're also using methamphetamine, and give some examples, of what that looks like. If you have actual data, prevalence data, like, 10% of this population and 20% of that, by all means use the data. And again, you might check with your tribal epidemiology center. But at a minimum, you can go to SAMHSA's drug, and it gives you the name of it here, the American Indian Alaska Native Survey, and it will tell you what the percentage of use is by Native Americans, and then you could even apply that percentage against your population to come up with what that looks like in your community. That's if you don't already have the actual data for your community. So this is where you only get one page and it's only 10 points. So it's like in one page, how can you describe? But remember to come back to the wording here, because they also want to know about service gaps. So, we don't have medication assisted treatment, or we do, but we really lack recovery support, or we don't have case management, or we don't have peers, peer recovery. Whatever it is, because realize whatever you put in this one page should directly feed into why did you pick the strategies that you picked to implement. So there should not be a total disconnect between what you say you need in the first page there, section A, and what you asked for in your budget and in your implementation pages to follow. So I want to stop there and see if anyone has any questions. It's just one page narrative description of the problems in your area using data when you have access to it.
I just got an email back from Beverly about the user population, because that'll go into your encatchment.
Yes, that's correct. That's
So
a really good. What'd she tell you?
My question was, so we can apply for funding based on our user population, but can we serve non-IHS participants?
And what'd she say?
She says you would apply for funding based on the user population. The FOA specifies that services are to be delivered in tribal communities. If there are individuals in this community who are not IHS participants, but need the treatment services offered by the grant, it is fine to provide services to them.
Okay. So this would be a good thing to include in that area, in that section of the grant, what your catchment area is and how many people there are. What you also want to be able to do is, if you do not have good data, then obviously you're going to want to make sure strategic planning is something you spend a little bit of time on in year one, because you really need to get to know whether you're making any progress. You got to know where you're starting. So, you'll want to mention there, this is what we know from our tribal council, or this is what our elders are reporting, or like in some applications, I've seen things like, elders will come to the pain clinic to get, maybe they're older and they have aches and pains or injuries, and they get their pain, they go to a pain clinic for pain meds. And then when they walk out the door, they're accosted by dealers who are trying to buy their pain meds right from them for a lot of money. Other communities might have rampant problems in the school system with youth, or their pregnant women are delivering. I know that the percentage of babies born in Indian country with neonatal abstinence syndrome is higher than almost any other population. So be thinking about, you don't have unlimited amount of funds, you have a limit. What is it that is a rising priority in your community that you have either a need and or the capacity to serve? You don't have to serve everybody, and especially if you have a small amount of money. So it's better to hone in on a particular population that you feel good that you can serve successfully and get some decent numbers in. Because I know that we have not as a whole cohort, we have not done well in this initiative with numbers. And it is a sore point. Congress wants to know how many people did all these millions and millions and millions of dollars serve. And right now, those numbers are not real big. And so we worry a little bit about this funding going away if we can't get a good traction on numbers. So, you know, think about what you feel like you can serve. And maybe it's a small number in treatment, but a larger number in prevention, you know, or in recovery services, or, you know, so you kind of mix and match to get some decent numbers. Okay, proposed implementation approach. This is where you get your most points, section B. This should be your really carefully crafted section. And they're saying approximately 5 pages. Now, these are guidelines, guys. So if it tells you 1 page to discuss need and 5 pages, these are just guidelines. It can be a little more, a little less, but you cannot go over 10 pages total. So this section says, how will you implement your required activities, and how will those activities meet your goals and objectives? So, and they want you to state the unduplicated number of individuals you propose to serve in your first year and over the whole grant period. Well, remember that they want you to start within the 4th month of grant award. So they allow you the first few months is planning, hiring your staff and all of that. So the number that you will serve in year 1 will be smaller than the number in year 2, because you should be totally up and running by 4 months. So how I think of this is, it's easier to take a step back and say, how many people can I serve in a year? And then take 75% of that number. Well, wait, what's 4 months? You're supposed to do it by the 4th month. So yeah, so 75% of that number would be how many you would probably serve in the first year. So if you're going to serve 100 in year 1, you might serve 75 in year, I'm sorry, if you're going to serve 100 in year 2, you might serve 75 in year 1 to allow for startup. And that's if you're starting right away on the beginning of your 4th month. This is where, when I suggested that you take your required activities that you're going to do and maybe put them in a chart, and then in the other column say how you're going to implement them. This is where all of that rich discussion and narrative will go, right here. These are what's required. This is how we're going to do it. It does say that it wants you, you know, how you're going to meet some goals and objectives. You don't have to have a lot of goals and objectives. Maybe here's what I think of. Before, I suggested that you look, you're increasing access. Okay, so let's say one of your goals is increase access. One way you might do that is through having peer recovery support, doing some outreach, even going out to the different workforces in your area and doing training about how to refer clients, how to identify somebody using opioids, how will they get into your system, you know, to get help. So you could literally, you know, start this section with 3 or 4 goals: increasing access, reducing overdose, you know, reducing gaps, that kind of thing. And then you could just name those goals at the beginning, and then all of these required activities could become objectives. You know, by such and such a date, hire staff for peer recovery, hire a peer recovery support specialist, or conduct 5 trainings by, you know, 6 months of grant award, or what have you. You know, so in other words, tie your goals and think of your required activities as your objectives. You don't need to be thinking out of the box of how can I dream up some objectives. Those activities can be your objectives. Just have maybe a date you might want to start them, or how many people you might serve in them. Let's stop there for a minute and see if you have any questions about B before we cover the last 3. Anything, Jeff? Nope. Okay. So now you go into your proposed evidence-based service, which is really where you're going to discuss your traditional practices, and also you can probably talk about medication-assisted treatment in both B and C. But really C is a good place to make sure you're discussing MAT as your evidence-based practice, and we think of your tribal practices as evidence-based. You've been doing them for, thousands of years, and you have good oral documentation about the effectiveness. You know that they work, and that's enough. So, but maybe you talk about what you will do and how you will integrate those with other evidence-based practices like motivational interviewing, if you're going to do that, or cognitive behavioral therapy, or and medication-assisted treatment. Does anybody have any questions, or maybe, I don't know, Annette, if you want to talk about how you integrate your medication with culturally relevant tribal practices?
Yeah, we listed it in our last one, and for us, it's heavily focused on peer support and case management and things like that. So relationship building is huge within our community, and networking.
Mm-hmm. Have you had any, or any of you on the phone, if you are experiencing problems with tribal leaders or tribal elders that are against medication, or that are against helping people with opioid use disorder, or are against bringing somebody back from an overdose? If that is the case, then you want to discuss that up in section 1, a couple sentences, because you don't have a lot of room, that discusses this is a need that you really, in addition to having opioid use and this problem and that problem, or this challenge, that you also have a need, that's, you've got a need to bring some of your, either your tribal elders or your tribal leaders, or both, up to speed on, or help work with them over time. It might be a long process to get them to be more supportive, because a lot of times you'll get these clients into treatment, but they don't have the support of their family members or some of their key tribal leaders, and that they might not be as successful. Okay, staff and organizational experience, 15 points. You have to list who your staff positions are, and they really are primarily looking for your key personnel. If you're only going to have somebody 10%, you don't have to you have to list them, but you don't have to spend a lot of time describing them. But you'll want to really spend time, and you only get 1 page, so you're talking a few sentences here, describing who they are, what their role is, what their qualifications. I like to do this in a chart, because then you can go down to size 10 font. And I literally, like to create a chart that says staff position, percent time, which is called level of effort, and what their qualifications are and what their role is. And you can do all of that in a chart, and what their familiarity with culture and language is. These are the first funds for tribal communities. And so we obviously want to hire tribal staff when we can. If for any reason you need a certain level of staff that you don't have a tribal member with those qualifications, or a native person with those tribal, qualifications, let's say, somebody who can bill for the service, then you'll want to make sure that you hire somebody who has experience working with tribes, that's culturally competent as much as they can be. You want to make sure that you talk about that they're going to get a lot of ongoing training, because really, to the extent possible, this should be run, by and with Native people, to increase the effectiveness when that's possible. So that's only 1 page. It's very clear. Do mention if you have done Native connections, or the other one you mentioned was Matt Padoa. Any other federal grant that you have implemented before, if you've done it successfully, you'll want to add a sentence or two that says, we understand what's involved in implementing federal grants. We have successfully administered several federal grants before, maybe name 1 or 2. And we even have 2 right now that we will coordinate with. And they're, and you'll have to probably abbreviate their names, because there's not a lot of room there. The easiest sections to write, just so you know, are section A and section D. You only have 1 page. You really have a couple of three, paragraphs. You don't have a lot of room. But you'll want them to know that it's not your first rodeo if it isn't. If it is, then that's okay. You'll focus more on the staff that you're going to hire. And then the last section E, provide information about how you will collect the required data for the program. This is also can be an easy section to write for two reasons. One, if you have an evaluator that you're going to hire for this project, maybe ask them to write it. If not, I'm going to have Jeff scroll and search for this word called performance, because everything you need to include in that one page is spoon-fed to you in this page coming up. And it's very easy. Oh, wait, go back real quick, Jeff. If you have not ever registered to this page right here, and is really important, that shows you the 4 registration processes, and here in the application it tells you how to do it. It does take up to 6 weeks. It might not take that now because of the fact that we're in COVID and a lot of people are home with, working telecommuting, so they're getting more done. But hopefully, because we're already getting close on time, you've already done it. But go back and see for, wait a minute, here you go. Okay, if you look at this, Appendix F, this is right inside your NOFA that we're going through. This tells you what they're looking for. But you know what, wait a minute now. Can you go back? There's even a better one that gives you narrative you can use. And it talks about, keep going back. It talks about, okay, by the way, stop right there. This is the confidentiality participant protection that I told you is kind of hard to fill out. You'll have to copy and paste this into your grant. It's an attachment. I think it's called attachment 4. And this is kind of difficult, but, and we can maybe help a little bit with this later, but keep going back. And there's something that talks about, it's really good questions that you would ask in your evaluation, like how many people are you serving? What kind of, keep going. Let's see here. It has a bunch of bullets, and everything in there should go right into your, let's see, keep going. The good news is if you make a decent effort, it doesn't have to be perfect. The goal is, no, it's still back. It's still way back. It's before, Jeff, it's probably like on page 12 or something. And it should come, it's probably even before, it might even be before the section we were just in. Go backwards a little bit closer up to the top of the grant. Okay, I think we're getting close. No? Oh, wait, there it is. Wait, performance assessment. Okay, here you go. Let's see. Can you scroll a little? So one of the things I would do is I would parrot some of this back. So it says here, all SAMHSA recipients are required to collect and report. I would say, our project will collect and report data, GIPRA data. Our tribe or our organization will collect and report GIPRA, and this GIPRA data, and we will report it. It tells you how often at 3 collection points: face-to-face, intake. In other words, parrot this back, because you're required to do this. So you might as well just say, this is what you're going to do. And, kind of just using some of this example. Go a little bit further, Jeff. There should be some kind of, there's a really good thing that has questions. And I'm going to try allowable activities. No. It talks about, we'll just go real slow for the rest of the, just go real slow paging through the rest, because I want to look now to see what's not allowed. Keep going. And I want to see if in here it has the, Okay, stop there. Go right back a minute. It says here, right here, perfect, stop. Grantees will be required to report data on elements including but not limited to diagnosis, demographic characteristics, substance use, services received. All of these are things you're gonna, by the time you're done saying that this is what you're gonna do, because you're required to do it, you'll have 3/4 of your evaluation already written. Because you're telling them you understand that this is what you're required to do. And if you know who's going to do it, you might mention this will be done by our evaluator, Dr. Smith, whatever. So by the time you're done doing that, you're almost done with the whole section. Keep going a little bit further, Jeff. Okay, now let's scroll and see. That was the whole end of what you have to do, but I want to go and see if it has anything about what you're prohibited from doing. So keep going, see if it says something about prohibition. While we're scrolling, let's take questions. And also, Shirley, I don't know if you have anything you want to add from all your review, or Joanne, okay, stop there. Let's see, wait a minute. Okay, this is just saying you're not allowed to deny somebody medication. Keep going. I want to see if there's anything here that says that you can't, if keep going. All right, while we're looking, is there anything you wanted to add, Shirley or Joanne, about any guidance to these folks?
Well, just what I said before, and I think Joanne, she saw it too, you know, in our reviews.
Mm-hmm.
Try not to overshoot. You know,
yeah.
Don't overshoot, because it makes you look bad, really, if you can't fulfill all those requirements. You know, do things you know you can do.
Yeah.
You know, like here's an example. We did when I was practicing law, we did a VAWA grant, and we said we'll serve 50 women the first year. 50 women, you know, that are involved in order for protection cases. We served 75. So we look so good, having served more than what we shot for. So, you know, to me, shoot for something that's manageable, but if you get more, then that's awesome.
Yeah, I like that. But just also remember that whatever number you pick, you know, some of you have a way of guessing or finding out from your programs what it costs to provide service. So let's say that it costs $5,000 to provide outpatient services to a person. And you say you're going to serve 10 people. 10 people times 5,000 is 50,000. That would be spent on treatment. But if you ask for 300,000, they're going to say, well, wow, what else are you doing? You know, why is that? So either you've got to have other services, or maybe you up the number a little, but again, better to be, like Shirley says, you know, something that that's more reasonable. And remember, if something is more complicated or you're not feeling as good about it, mention that you're going to do that in year 2, because what will happen is you'll get a lot of support when you first come as a grantee. You know, your GPO will be there providing technical assistance, and we can help you with the hard things, you know, as you go. But get your feet wet if you're a new grantee, and start with something like Shirley says that's manageable, that you feel good about.
So one other thing, Pam.
Yeah.
This came up when we were talking with the OVC grantees as well. What a lot of the grantees are putting into their proposals is the cultural piece and the spiritual piece, but there's nowhere in GIPRA that actually helps them count that as a evidence-based practice. So I'm trying to research how to do that, you know, like an indigenous evaluation model. Yeah. You know, because people should be getting credit for their work, and
right.
They're only getting credit for the numbers.
And so when there is a GIPRA help desk that you can contact, and we'll probably, like you, Shirley, have to kind of help on the side. But there's the issue with GIPRA is if you're new and you haven't done it before, it's a lot of data collection. So you have to find out things like, you know, their sex partners, not who they are, but, you know, I think there's questions about unprotected sex, or about whether or not they have same-sex sex. It's like, it looks at risk risk kinds of things. Well, there are some practice. If you have somebody in treatment and they're with you for a long time, you're going to develop the kind of relationship that they might sit with you and tell you those things. You are allowed to skip, by the way, if they don't feel comfortable. But if you're doing a community ceremony and that's one of your, one of your cultural practices, it might not be practical to have everybody that's in the ceremony sit there and get a 20-page question that asks very personal questions. So, and I guess what I'm saying is some practice, I'm not disagreeing with you, Shirley, because I do think there should be a way to get more credit, but some practices may lend themselves more to a GIPRA evaluation than others. And this is a huge area that we need your help in, Shirley, on the side. We might want to have like some meetings about this, you know what I mean?
Yeah.
This is much bigger than this portfolio. This is something as big that covers all the tribal portfolios.
I have 3 things to just suggest.
Yeah.
When you write your objectives, always reflect back to who the user population is. So make sure those objectives are serving that population and define those in sync with that population. Also, when you talk about prevention and outreach, be sure to bring in your partners. Like Pam had mentioned last time, you don't have to go into long descriptions, but so that they can see that you are creating sustainability with other partners. And then look at ways that you can create with the outreach that you've done or plan to do, how you can extend that maybe through social media. So mention things that you're going to start with a project, but how, for example, that Pam mentioned, Not on My Res. So they had a tribal radio station and they wanted to get the message out about Narcan and really engage youth. So that's how it started with the radio station, but then it got legs. So they had youth dances, they had simultaneous dinners with community centers. So it got broader and broader without spending necessarily that much more money on a particular media, what do you call it? A media product. So a brochure or a PSA or whatever. Make sure you can create an extension. And then when you look at your grant reconciliation, as you're checking in on your grant as you progress, make sure that the data points that you're looking for also match, and then it's easy for you to reconcile that grant as you go. Having done grant reconciliation, that can be maddening when you go back to the framework of the beginning grant and the data points don't match up and the data that you're collecting is not really consistent with the user population that you served. So make that easy on yourself.
All right, so what we can do now is see what kind of questions you might have. I was going to tell, you also have an abstract that you have to do, and I always do those last, and they give you I know, Jeff, can you pull up the job description? That was one of the things I sent you earlier. So there's a couple, even though it said, when you go to upload your grant, even though it said that there were only 4 attachments, 1, 2, 3, 4, all of a sudden they're going to ask you for resumes and job descriptions. And that was not in attachment 1, 2, 3, or 4. And you're like, holy, you know what? This is due in 12 minutes and I didn't even know that was part of it. So a couple years back, we created a job description for you this is a sample job description. I actually wrote this, and I haven't looked at it in a couple years. You can make it your own. You don't have to use this. But what happens is sometimes people turn in a project director job description that has absolutely nothing to do with opioids. It has nothing to do with whatever the grant is about. If you end up doing that and you don't have time to customize that to this grant, then put a note on it that says this will be updated to reflect grant activities if funded. But anyway, here, this is one, I mapped this job description to the actual application. But feel free to use it. And Jeff, how can can you also show them the TOR resource page, or is that too hard to get to from here? But yeah, this is because you're allowed to only do a 1-page job description, and I think you can do a 2-page resume of people. And so if a lot of people have a long resume, just put the first 2 pages in and write on there before you upload it, or type on there, or put a text box on there that says the balance of this resume is available on file, you know, something like that, because they do limit you to a 1-page job description. You don't need a job description for everybody. It's only the main staff. So again, if you've got like a 20% receptionist or something, not a problem. But if it's going to be like your therapist or your case manager or your peer coordinator, you know, then this is just one example. If you don't have time to do those things, don't not come in for the grant because you couldn't get it in time. I mean, the job descriptions. Don't let that be a deal breaker. You know, it's likely they would just ask you to send that after you get awarded. So the most important thing is turn something in as good as you can make it. 10 pages, get that part in, get your budget forms in. And also, I just reviewed a grant recently that someone sent in, not for this, but they had a full-time receptionist that they paid for, and they were only serving 14 clients. That's really hard to justify, you know. So make sure that it makes sense, that whatever you put in your budget makes sense to the number of clients, the level of effort that you're going to be putting forward in treatment or in prevention, so that it doesn't, you know, that it's reasonable.
Also, in the chat, I've added a link to our TOR resource page where you can download this document for yourself, along with implementation plans for TOR, the director interview questions that you drafted, Pam.
Oh, yeah.
And your strategic planning template.
Yeah, and Joanne put together a beautiful example of all kinds of cool things that are happening in TOR of your fellow grantees. And hopefully we'll have that up. I know, Joanne, you added something new to it today. Hopefully in the next day or two, maybe Monday, let's say, we can get that up there on the TOR webpage. So check back to get that. We don't have time to go into it now because it is time, but we can, but at least know that there's a really cool resource that shows you some clever ways and and ideas that you might want to incorporate in your allowable activities. And some of them can even line up with your required activities. Any questions that we have right now about any of the things we covered, or even something we didn't cover?
I think Michael had a question about hiring a project director. Where can he get ideas for a job description and wage range? Also, assuming that a large portion of the grant would go to wage and fringe, is this allowable?
Yes, so the job description, just coincidentally, we happen to already have up on the screen. He might have sent that question before we showed it. And yes, the salaries, you know, I am always humbled by the salaries that I see coming in on some of these grant proposals. And I always feel like, you know, if you have a chance to pay somebody what they're worth, even if it's on a grant program, you know, then do it. If it doesn't cause you problems with the rest of the team, that might be, I mean, I understand this is easier said than done, but if it's a brand new program and you're starting, you know, then yeah, you know, you want to have a wage that makes sense for the position. But read the question again, because I feel like there's part of his question I'm missing that I didn't answer.
Assuming that a large portion of the grant would go to wage and fringe, is this allowable?
Yes, and that is primarily these things that are done are provided by the staff. So yes, the vast majority of your budget will be the staff. The services piece will either be being delivered by those same staff, or in some cases billed to Medicaid, to insurance, to the Veterans Administration, whoever it is, you know, that might have IHS, you know, wherever you've got a way to bill those services, you're going to be doing that. But that means you might need a small percentage of a billing clerk if you're going to be doing insurance or Medicaid billing. So maybe you have and I'm making these numbers up, but you're going to have a full-time project director. That's required. You know, maybe you have some clinicians, you might have a peer support person, and you might have a part-time billing clerk. You know, that might be your whole team. You know, and maybe you have ways to leverage other resources if you don't have enough money to fund all of that.
So Pam, I have a question.
Yeah.
Is there a provision in there, or is there a portion that deals with sustainability or financial strategies?
No, there
Okay.
isn't, and there's not a lot of room because of the 10 pages.
Yeah.
But if you know that if you either are billing third party like Medicaid or insurance, and you have a good track record of that, mention that in the organizational capability section, whatever that was called, the staffing part. If you intend to bill, mention that, and you could always add a sentence that says, you know, our ability to bill third party will be maximized to the extent possible to ensure sustainability. So getting a sentence or two in there, but in other, you know, with 10 pages, they don't give you a lot of room for that, but it is important to mention it if you can.
It looks like Bernard says we don't have any of that support. Oh, sorry, Michael. Michael, actually, would you mind unmuting yourself?
So since we are starting on the ground level, I mean, I'm like employee number 4 of our tribe. So we don't have any, I mean, we don't even have a receptionist, billing, human resources, really any of that kind of support. How would you see this working for us when we really, that project director would pretty much be the whole program?
Yeah. Do you know how much you're eligible to go for?
I don't.
You know, is there a way that we can add that in real quick, that you can, Jeff, you can add that to the same person that gave Annette her number?
I think Beverly actually already responded.
Oh, good.
The user population for the Knights-y Indian tribe is 4,142.
So what does that mean for the dollar figure? Does someone have the grant open?
It's one of the lower numbers, I know that.
It might be 125,000. It was the last page of the grant.
Yeah.
So if it's the last page of if it's 125,000, then what I would do is then your full-time project director, you're going to have that. Would you be able to deliver any services? Because here's the thing, if you're a full-time project director, and let's say, you know, and it's hard to justify that. Let's say you have a counselor you're going to hire, a part-time therapist or something. You're going to have to do some of the work yourself on the grant, because it's not like you have this large staff. You're going to be there supervising all these people and having all these meetings. You see what I mean? In other words, so you are at 125,000. That's what your budget's going to be. So I would put yourself in for full-time salary. Maybe assign yourself some of the job duties, like doing some of the outreach to referral sources to let them know how to send you clients. You know, maybe you can hire a part-time therapist, and maybe you put the billing clerk into year 2, because it might take you a while to get the hang of the services before you can master the billing. Do you know what I mean? So you might have to be creative. But at a minimum, have you thought about what you want to do yet? Why don't you just give me a quick overview of what you think you want to do for your strategies?
Well, for myself, I'm working on trying to develop a youth program, so I wouldn't really need to be involved with this. I've just kind of been asked to put the grant together so we could get somebody on board that can kind of do the capacity building, the partnerships, the whatever is required of the grant. And like I said, it's for 125,000. It's probably going to be one person, and so I mean, why wouldn't we have clinics? We'd probably have to partner with somebody that could administer the medications and whatnot. So I mean, I'm ground level right here, and yeah, I'm just looking for ideas because I don't even know what a salary would be for a person like this. I mean,
Annette, do you have any suggestions on what a project director in a smaller community might make in Alaska?
If you're going to have a sole project director, I'd ask the question, could he primarily focus on community education prevention and overdose prevention?
Yeah. Good
and
idea.
As somebody who that's my sole job, I will say it's like a $25 minimum. That's like what our peer support make in our community. So it's like 25, but as a project director, that's a lot more because you're doing so much case management and education and resource pulling. I mean, we had Matt come up here and do, so I would say like $25 to $30 an hour.
Okay, so you're talking an hourly wage, not a employee wage? Or that is an employee wage?
Yeah, that is, yeah. And my grant covers 80%. I'm looking at 50 to 80% of my salary for the TOR because I also work as a behavioral health aide, but it's all integrated. So for us, trying to find out how much funding, I do all of my job is basically TOR. So
yeah. Well, Shirley, did you do the math on that?
I did. It's between $52,000 and $62,000.
Okay.
That's very low.
Yeah.
It is.
So then it sounds like you could, that's why I keep coming back to like 1.5, if you could do all the, work, you're really, and so keep in mind, Section A is going to need to say, we are really new at this. Could you just tell me in a few sentences what you know about the opioid use problem there where you are?
I have no idea.
Okay. Do you have people you can ask?
I'm sure there's somebody I could reach out to. I just don't know who that is.
Yeah. Yeah.
If I can chime in real quick, in Annette's application that she shared, she did have some information pertaining to the whole Kenai Peninsula. So maybe we could utilize some of that. And that was information provided from the governor, I believe, back in 2017.
Excellent.
And
so,
I think one thing,
Mm-hmm.
Michael and I had talked about a possible part, because we're close in proximity physically than probably anybody else. And so we had talked about building a partnership to help them start, or, them networking off of some of our resources and stuff. So
yeah. Well, and they even had, right where it had I think the very chart that said how much you could get, it even had a note that said, if you partner, I think you can add those dollars together. Was it up here? Did it say?
I said it was about the consortium.
Yeah, maybe you have to, we might have to.
I know what you're talking about.
Yeah, it was under the word consortium, yeah. So there are ways you could merge together, I think send one application, but have the twice, have the budget reflect both. But short answer, and then I know we have to end, but the short answer would be, it sounds to me like if you are very clear in Section A that this is a new area, you really want to spend the first few months getting your finger on the pulse of like what the problems are, and that you will be the full-time project director, you are going to be doing all the community outreach, meeting all the people, helping get a strategic plan in place, and then maybe in month 4 is when you hire your next person, and that'll save you on budget dollars. There's no reason, and that's the other place people make a lot of mistakes budget-wise. They start all their staff in the first month when they don't even have a program running yet. So really you want to show, your budget would show maybe 9 months of a counselor, and it could even be a part-time counselor, or 9 months of a, maybe you're not going to do treatment, you're going to do peer recovery support. And like you said, connect your people with opioid use disorder to existing MAT programs. So your staff might be 1.5 people, you full-time and a part-time peer recovery support, maybe a full-time peer recovery support and some travel dollars or something. And the goal is get in the game. You may be having to revise this after you get your grant award. Your project officer might work with you to reconstruct things a little bit, but I would just put something in because I really think you're going to get it if you just make a good faith effort to put something on paper. Any other questions before we end? And you know, if you need us to help you out next week with any follow-up, you know, I'm available. I don't, you know, we can figure out how to best do that, but y'all can just reach out to Jeff if there's some other assistance that you want, and we can maybe individually help as needed. Between all of us, you know, we could figure it out.
2 things, Ms. Joanne. We did hear a lot of what Pam just said, where people readjusted. They weren't, somebody else wrote the grant and overpromised, and they didn't have those resources. So there is adjusting that goes along as you progress. And then in the chat box, I just put a link to all the cohort 1 TOR grants that were funded, and SAMHSA did their own summaries of those, and those might give you kind of an example. It's not the actual submitted application, but it's just a kind of a review, and it will include the user population, objectives, and kind of the broader scope of the grant.
And that's under, if you go to samhsa.gov, like where you found this announcement, you can go back in, there's something called archives, and you can click on it and you can look at who got awarded last year, who got awarded the year before, and then they have little project summaries.
Yeah, this is.
All right. Well, we'll be here to help, you know, throughout next week a bit here and there. If there's something we can do, let us know. And hopefully this was helpful, gave you some ideas. Hit that TOR resource page big time, because you'll find some other resources that might be helpful to you.
If I can chime in real quick, I want to thank all the facilitators for taking time to do this session for our tribes. I mean, this is so helpful going forward. And I will send a contact list to everyone, so everyone will have contact information for all the participants. And I'm happy to help as needed moving forward with any communication. So thank you, thank you, thank you.
Excellent. Well, thank you for inviting us in, and we're happy to help. So we will send you good wishes, and Shirley's Tobacco sending good wishes for positive, you know, success with the scoring, and let us know if there's anything we can do.
Perfect. Have a good weekend, guys.
Bye, everybody.
Thanks for your time, everyone.
Yep.
Hey, Jeff?
Yes.
So the recording that you did for this thing, what's the best way to distribute that or have access to that? I know it's going to be probably about 30 to 50 megabytes.
Yeah, I'm actually not certain. This is my first time trying to record with Zoom.
Okay.
Do you have any recommendations?
Well, I think with a file size that large, it's probably going to be like a Dropbox type of format. I don't know if you use Dropbox or any centralized data sharing location like that.
I'll ask my team.
Okay.
I may not be able to get it to you today, though.
No. There's no rush, but I think after the call, it's going to compile the video, and then it'll give you an idea of how large the file is. And then moving forward, you know, if you do a Dropbox or anything like that, just let me know, and I'm happy to help if needed.
Okay, thank you. That's very helpful.
Cool.
All right.
Have a good weekend.
Have a good weekend.